IDB එකෙන් ඉන්නවද?
ඔව් ඉන්නවා පොඩ්ඩක්. අපි 10:30 පටන් ගමු නේද?
ඇහෙනවද?
ඔව් ඇහෙනවා.
මට පොඩ්ඩක් ෂෙයා කරන්න පුළුවන්ද මේක පොඩ්ඩක් චෙක් කරන්න?
alright. මොකන්ද ડોකියුමන්ට් එක තියෙන්නේ? ෂෙයා කරන්න පුළුවන්ද මිස්ටර්? hello. Good morning, everyone. Today we are here to conduct a discussion on pharmaceutical sector and make the industrialists aware on this sector. So we have gathered here to discuss regarding this. So I warmly welcome Ms. Diani Madhunika, Assistant Director, Industrial Products Division in the Export Development Board, to conduct the session. Over to you, Ms. Diani Madhunika. Hello. Ms. Diani? Ms. Diani, are you there? Ms. Diani?
පොඩ්ඩක් ඉන්න විනාඩියක් දෙන්න.
All right.
කෝඩ් එක දෙන්න. අපිට විනාඩි 5ක් දෙන්න පුළුවන්ද?
All right, Miss ready වුණා හරියට තියෙන්නේ.
හරි හරි.
හරි.
පේනව නේද දැන්?
Honey, we
ID
start.
ඔව් පේනව
Okay.
නේද දැන්?
Oh,
ඔයාගේ නම මොකක්ද?
Nadija. Nadija gamage.
නදීෂා.
Nadija.
නදීෂා. මම ඇහෙනව නේද clearly?
Oh, Miss Ahena. Peno.
පේනව
Miss video එක
video call කරමු.
හරි. Start කරන්නද? Good morning. Okay නේද? Start කරන්නද? Right? හරිනේ? Good morning, everyone. Today we are here to conduct a discussion to make the local and foreign industrialists aware on the pharmaceutical sector in Sri Lanka. So to conduct the awareness program and the discussion, we have cordially invited Ms. Diani Mazunika, Assistant Director, Industrial Products Division in the Export Development Board. So welcome you, ma'am. So can we start the discussion? Over to you.
Yeah, sure, Nadija. Thank you very much. So, my name is Diani, Assistant Director, Sri Lanka Export Development Board. I am going to tell you something about the pharmaceutical sector, mainly in Sri Lanka. First, Sri Lanka pharmaceutical sector has been identified by the Sri Lanka Export Development Board as one of the promising and emerging sector in Sri Lanka to promote as an export-oriented industry to earn foreign exchange. So, nowadays, local manufacturers of pharmaceutical are developed over 120 molecules, and further, local manufacturers fulfilling around 20% of local pharmaceutical market, whereas total import of pharmaceutical in Sri Lanka is 450 million US dollars. So to discuss this session, just I want to differentiate between the herbal medicine and pharmaceutical medicine. Herbal medicine is organic and only lightly processed, whereas pharmaceuticals mostly made out of active pharmaceutical ingredients, which called as API, derived from a natural source after lengthy and very complex process. So this sector itself is a highly technical sector and very complex sector when there are some regulations and technical aspects as well, because it is a pharmaceutical and it is consumed ultimately by human as well as animal. So after this slide, I'm going to sorry, there's a technical error. So I'm going to describe about Sri Lanka pharmaceutical sector. This sector is, as I told you earlier, this sector is very technical and complex processes are there. Sri Lanka as a small country, they have achieved the target of producing pharmaceutical as well as exporting pharmaceuticals. Sri Lanka pharmaceutical sector mainly two sectors, human pharmaceuticals as well as veterinary pharmaceuticals. Human pharmaceutical sector there are 32 companies in Sri Lanka, mainly 22 companies large scale and 10 companies doing small scale, including dermatology products and other primary products as well. And veterinary sector, we have 4 companies. They are doing small scale, but contributing to the Sri Lankan economy heavily in pharmaceuticals. So I am mainly focused on human pharmaceuticals because it is a mainly major sector, and it is a main focusing and currently as well. So this slide I am going to go through on the milestone of pharmaceutical sector. It has been started in 1956, establishment of first privately owned pharmaceutical manufacturing facility. The company established as Demex, Danish multinational company who set up the pioneer pharmaceutical manufacturing plant in Sri Lanka at first time. Now it is operating as Aston Private Limited with Sri Lankan ownership. Then, in 1987, government of Sri Lanka, commencement of government-owned company, which called SPMC, Sri Lanka Pharmaceutical Manufacturing Corporation, in 1987. In 2015, it started the buyback agreement. Let me tell something about the buyback agreement. It's the facilitation given by Sri Lanka government to the local manufacturers, whereas local manufacturers are entitled to get buyback guarantees from the government, and ministry, health ministry makes direct purchasing from local manufacturers. This policy mainly focused to minimize pharmaceutical importation cost while ensuring the highly quality supply stream. Then in 2017, the SPMC initiation of joint venture partnership with 5 companies. Now they are operating with 5 joint venture partnerships. In 2019, the renewal of buyback guarantee, because it was for the 5 years period. Now it has been renewal considering the contribution to the Sri Lankan economy from the pharmaceutical sector, and the government ensured the development of the pharmaceutical sector. There's a remarkable milestone in 2022 as establishment of Oyamadu Pharma Zone. It is a big milestone in Sri Lankan pharmaceutical sector. I will describe more on my future slides as well. Now, we are going to the new key players of pharmaceuticals. It's Aston Limited, GSK, Morrison, and Navesta. Let me tell something about Morrison and Navesta. The companies are focusing on EU, getting the EU GMP. Navesta will obtain the EU GMP as well as PICS in 2020, end of this year, and Morrison is in the process. And Lina, SPMC, Gamma Interfarm, Yarden International, Emergent Life Science, and ACE. These are the main key players doing pharmaceutical manufacturing. This is the dosage forms of local manufacturers' medicines. This is somewhat a sample. They are doing a lot of products in Sri Lanka, but let me describe some samples what they are manufacturing. Oral solid dosage products, oral liquid solution and suspensions, powder for oral suspension, dry powder inhalers, metered dose inhalers, injectables, gels and balms, topical solutions, medical gases, ointments, oral liquids, and tablets. From this, I'm going to describe about the Oyamadu Pharmaceutical Zone, which is located at Anuradhapura Oyamadu area, and it has I informed earlier, it has established in 2022 from the Sri Lankan government. This is only inclusive for the Sri Lankan pharmaceutical sector uh, going to expand their pharmaceutical products. This Oyamadu Pharmaceutical Zone mainly focus on critical pharmaceuticals like biosimilars, hormone products, syringes, medical devices, and cancer products as well. So it is a remarkable milestone which has been stepped by Sri Lankan pharmaceutical industry. There are 12 companies, emerging companies are coming on. They will uh, do their commercial production on 2025. They are going to plan their commercial production on 2025. There are 12 companies has already signed the buyback agreement as well for 10 years. Epion Health Services, Maliban Bioventures, Luxus Mediline Private Limited, George Stewart Health Private Limited, etc. There are 12 companies. Their investment is around $100 million. Now, I'm going to move on to the regulated authorities of Sri Lanka for the Sri Lankan pharmaceutical. Human pharmaceuticals, it is National Medicine Regulated Authority, which called as NMRA, which is under Health Ministry of Sri Lankan government. Veterinary pharmaceuticals, it is Veterinary Drug Control Authority, which is called as VDCA, which is under Animal Health and Production Department. So this is the main authorities that govern the pharmaceutical sector, and each pharmaceutical production produced by in Sri Lanka has to be registered by those governing authorities. It is a mandatory which ensures the quality of the pharmaceutical in Sri Lanka. So let me just glance on the certification and registration requirement. This is WHO GMP, Good Manufacturing Practices. So this is the mandatory requirement of pharmaceutical production, and EU GMP. Basically, most of the countries, the advanced countries, including Europe, they are focusing on EU GMP certified products. And ICH guideline, it is a harmonization of all the GMP, International Council for Harmonization. Pharmaceutical Inspection Cooperation Scheme, it is actually a membership, fixed, we call it as fixed certification. Last one is manufacturing standards such as US Pharmacopoeia, USP, European Pharmacopoeia, Indian Pharmacopoeia, IP, and British Pharmacopoeia as well. So now we are going to move on the major exports markets. In Sri Lanka, it is, you see that we have gradually improved in a small phase, but in steady phase. In 2022, US dollars 7.01 million has been exported. The main markets are India, Japan, and Maldives. Now, we are focusing on African region, Asian region, and Europe. African region, because these are the countries that we can achieve in our current status, because it is semi-regulated markets. Those African region and Asian region are semi-regulated markets. But in European region, there are two companies which are on the process of like Myanmar, Cambodia, Malaysia, Nepal, Singapore, Vietnam, and uh, uh, Indian as well for the contract manufacturing. Europe, we are mainly focusing on Russia, Romania, and Belarus. Those are the countries that we are focusing on. So, I am going to describe about why Sri Lanka, why we want to, why foreign communities want to import from Sri Lanka pharmaceutical products, because they maintain in Sri Lanka, they maintain the competitive prices because government is assisting heavily on pharmaceutical sector. So they are giving some assistance in means of buyback guarantee, as I described earlier, and some uh, tax decisions and lot of other assistance as well. Other thing is we have upgraded plants, facilities, and companies. There are two companies have invested in EU compliant facilities as well. Other one is USD 100 million investment done to expand and improve the manufacturing capacity, because when products improving the manufacturing capacity, it shows the continuous and quality production of pharmaceuticals, and it ensures the quality of the pharmaceuticals and the standards. The in means of capacity, so the companies mainly focusing on and planning on those capacity improvement. Tablets, it is 6 billion 2018. They are going to increase 15 billion. So capsules 520 million to 125 million. Likewise, dry powder inhalers, it is 220 million. Now they are going to, in 2025, they are going to expand as 400 million. And dry powder injectables, it is 24 million. They are going to improve the 40 million to the 40 million. That means they have the capacity for the local manufacture, local consumption, as well as export community consumption. And they are on the process of improving their capacity further to cater for the export community. Now, for the from the export community, we are seeking the opportunities for the global market. Supply of pharma distributors, because this sector is unique, and we are mainly seeking not only buyers but the distributors. So it is the main focus. What we seeking is the distributors, because they are the major party that can improve, and that are the main party that import pharmaceuticals for their country. So we are seeking pharma distributors and investment of joint ventures or direct pharma parks, contract manufacturing. Uh, Mainly from the countries, from European as well as Asian countries, we are seeking for contract manufacturing opportunities. And we are seeking for technical partners, partnership in licensed products for Sri Lanka and regional markets as well. this is the final point, tender markets, because most of the countries, governing bodies doing tender markets because it is a large market. So we can cater for this. So at the end, I am going to tell that pharmaceutical sector is itself, it's a promising market as an emerging market in Sri Lanka. So uh, it is not uh, popular in Sri Lanka in past. It will be a definite factor for development of exports in Sri Lanka in future. Thank you very much. Over to Rita.
Okay, thank you, ma'am. Thank you for the valuable information you have shared with us relevant to the pharmaceutical sector. Thank you very much. Have a good day.
Thank you.
හරි නේද මෑ ඊළඟට ඉන්න මිස් ඉනෝකා ඉන්නවා නේද?
ඔව්.
හරි.
එහෙනම් මම ලීව් වෙන්නද මොකද කරන්නේ?
මේකෙම තමයි කන්ඩක්ට් කරන්නේ Zoom link එක. මිස් ලීව් වෙන්න අර log වෙන්නේ නේද? ඉනෝකා.
ඔව් ඒක ප්‍රශ්නයක් නෑ. එහෙනම් මං කියන්නම් මේකෙන් log වෙන්න කියලා.
ඔව් ඔව්.
ඔව්.
link එක එකයි password දාලා එතනින් log වුණත් කමක් නැහැ.
මෙතන මේ තියෙනවා link එක තියෙනවා. හරි හරි. ෆෝන් කරේවා Hello, Miss. ඔයාට පේනවද මාව?
Hello. Oh, Miss. Good morning. Hello. Hello.
Good morning.
හරි අපි start කරමුද?
හරියන්න. විනාඩියක් දෙන්න මම මේ
Miss ready
විනාඩියක්
වුණා?
දෙන්න මම පොඩ්ඩක් කොම්පි
ඔව් ready වුණාම කියන්නකෝ.
හරි මිස් පටන් ගමු.
Okay. Good morning. Today we are here to conduct a discussion to make the local and foreign industrialists aware on the Ayurveda herbal products and cosmetics sector in Sri Lanka. So to conduct the discussion and the awareness program, we have warmly welcomed or invited Ms. Inoka Nirmini Vanasinghe, Deputy Director, Export Agriculture Division in the Export Development Board. So we warmly welcome you, ma'am, for the program. And can you explain about the industrial sector? And over to you, ma'am. Thank you.
Thank you very much. Good morning, all of you. We are focused on presentation mainly Ayurveda industry, including the herbal products and Ayurveda products in Sri Lanka. When we talk about the Sri Lankan Ayurveda and the herbal products, we know that we have a history more than over 5,000 years because we are Paradise is a tropical island and it is rich with herbal products and plants. That is the main strength behind Sri Lankan Ayurveda sector because our indigenous medicine, indigenous Ayurveda sector started over 5,000 years, used the Sri Lankan home-grown herbal plant for this industry. That based on our Hela Vedakam, herbal wellness practices, we evolved through our Hela Vedakama from history. Hela Vedakam is an ancient wisdom tradition of healthcare and healing practices that is evolved with our culture, heritage unique to native Sri Lanka. Knowledge and practices dispersed throughout the country and culturally bound. And it is knowledge we pass to generation. It is a very tacit knowledge in Sri Lankan Hela Vedakam that's come from generation to generation. The Hela Vedakam is mainly based on three dosas, that is Vata, Pitta, Kapha. This main core belief of the Ayurveda is that diseases and illness originated from an imbalance of these three energies. That's why the Hela Vedakam is mainly actually based on our healing power. That's why mainly it's considered as a culture and the traditional practices. Ayurveda consider bio-individuality and person entire body, mind, spirit connection. It's mainly willpower of the people are based on this Ayurveda Vedakam. In Ayurveda, we are normally treating for some illness or some treatment based on not to the symptoms. It's going for underlying problem of certain symptom. That is the main based on the Ayurveda medicine. Ayurveda medicine is aimed to look at the
root of diseases, how it is related to the person, thoughts, beliefs, and lifestyle. In other words, person's vital energy. It is based on the Ayurveda Vedakam. Currently, the industry has claimed attract, attraction from all over the world, mainly because of the ethical and planet-friendly solution. In Sri Lanka, we practice this due to the COVID period also. Our Ayurveda is useful to people to recover and the long-term recovery and prevent from the those diseases. And also, on the other hand, how the Sri Lankan Ayurveda and herbal products uh, recognized in the world because of the Sri Lanka is a well known one of the most biodiversity country in the world. Uh, and the Helavedakam and Ayurveda herbal directly linked with the cosmetic sector also. It is truly blessed with the bounds of time-tested medicinal plant as well as age-old beauty secret used by our historical queens and beauties, how they maintain their beauty in the past history because of this Ayurveda treatment and the herbal product that is unique to Sri Lanka. The mainly we focus on the Sigiriya Bitusituam, that queens and that painting, everything witness to how the Sri Lanka have recognized good herbal plants and the treatment. If the current situation, if we consider the current status of the Ayurveda and herbal products, uh, this flowchart is explain how it's linked with the commercial scale, how industry is organized, how is the value chain of the industry. So currently we have a little bit organized industry Ayurveda is because of we have a three established universities for the Ayurveda with the Kama and the Ayurveda medicines and the recognized doctors and there is a clinical practices and the people are commonly used Ayurveda herbs and Ayurveda medicine and Ayurveda treatment. Therefore, it is little bit structured and accepted treatment in Sri Lanka. It's been Ayurveda knowledge, it's Veda Kama. It is a village-based clinical treatment system. Now it's devoted to the Ayurveda hospital, channel service, doctors, and Ayurveda treatment center. From the other hand, Ayurveda well-being and medicinal tourism, specialized Ayurveda resort, healthy meals and yoga and meditation. From the other hand, OTCP product, general well-being, personal care, I mean over-the-counter treatment to the people. Like guys, this is the current value chain and the industry structure of the Ayurveda treatment and the product. Uh, Today, Sri Lankan Ayurvedic industry scope has developed into the modernized systematic method adoption with the qualified doctor, therapist, and the hospital and the product and channeling service, and ethical, classical, over-the-counter and personal care and beauty care product. We know that our Ayurveda spa treatment, resort, meditation center, all those this covers under this area and well-being or medical tourism service based on the tourism sector, wellness sector is promoted as one of the part of the Sri Lankan Ayurveda based treatment. It is another industry. We can promote Sri Lanka as a wellness destination. It's come as a part of Sri Lankan traditional Ayurveda. If we consider the Ayurveda mainly based on the herbal plants and herbal products, how we based on these herbal products, how these products goes to the exporter level and the treatment center, all those things, this channel from the local growers and the home-based grower and the wild collection. We know that there is a growers and village trader, and the dealer immediately goes to the village level collecting center and then goes to the exporter. Other than this, exporters are mainly demanded crop. They used to outgrow system and farmer trust organize the product, required herbal medicinal product for their end product, end manufactured product. This is how the local channel is organized. We know that the most of the Ayurveda medicines and the herbal products, we want to collect some very inherent and unique plants for those treatments and the product. Those things we collect from the wild catch. It means wild collections. Sometimes it is home grown, naturally grown in the home garden in the village area. Those channels are linked to these people and collect required raw material for the industry. This is the how supply chain is organized for the Ayurveda and herbal product. From demanded raw material, then supply, logistic, then goes to the manufacturing and distributor and retailer and consumer. This circle is rotate every time. Sometimes supplier goes to the manufacturer, sometimes manufacturer direct manufacture and the raw material level manufacture. It means that manufacturer supply required raw material for the end product producers. Like we know that Link Natural, Siddharth, well established companies in Sri Lanka, those manufacturers supply or sometimes directly supply the raw material. Then if any industry, it is a traditional or home-based or it is catering to the certain level of customer or consumer, we should have to follow the compliance. Compliance to meet the local requirement or maintain the industry standards. Not only for that, if we focus on the export market, definitely we should have to comply to the required regulation in the end market. The Sri Lankan Ayurveda medicine formulas are mostly either time tested or recommended by Ayurveda Pharmacopoeia. It means Ayurveda practitioners, doctors, they know how to treat and use this medicine for the human. Then those medicines are followed according to the Ayurveda Pharmacopoeia. We know that now the Department of Ayurveda, they have published on their website SOP, scope of the Ayurveda product, how they apply, how they approve certain product. There is a certain level of procedure to followed by the local or international company to get the Sri Lankan Ayurveda department recommendation. Because of that should be tested and clinically proven that good for use for the human being. Then all Ayurveda medicine and Ayurveda based OTC products, personal care and beauty product in Sri Lanka comply with the following regulatory bodies. Department of Ayurveda, as I mentioned earlier, it should be according to the Ayurveda Pharmacopoeia. It means product should be developed either with the in collaboration with the Ayurveda doctors, and then those products has to be tested with the Ayurveda doctors by a clinical trial. That's why Department of Ayurveda needs those proofs before approve their products. Next one is a National Medical Medicine Regulatory Authority, it's mean NMR. If it is not goes to the as Ayurveda claim, definitely it's claim as a herbal product, herbal cosmetic, definitely get the approval of NMRA because of that product used for the internally for certain treatment or externally apply for the skin or massage or some treatment, definitely get the NMRA approval. Then Sri Lanka Standard Institution. Sri Lanka Standard Institution is required to, the process should be followed by the GMP, it means good manufacturing practices, or we know that ISO, HACCP and FSSM, those standards are highly recognized standards in the international market. At least those one of standard should be obtained for the manufacturing processing facility. And separately, almost all the companies do adhere to the international requirement with adhere to the standards in caliber of ISO 9001 in 2015 quality management system or ISO 141 environmental standard and cosmetic GMP standard ISO 22760. It means if we use for the environmental friendly product and planet friendly raw material, we should have to follow the environmental standard and ISO 9000 quality management standard for the processing facilities and cosmetic GMP for the herbal and Ayurveda cosmetic product. From the other hand, certain level of certifications is need to follow and certify for the products that comply to the certain markets. We know that Cosmo Organic, Jazz, NOP, those standards are mainly specific certification for the end market, especially for the European region, Japan, USA, such a market. If we consider the local product, those are the main products currently we export at the different HS code as a herbal products from produced from Sri Lanka. These are the herbal tea, herbal preparatory preparation used for the herbal tea. Other hand, from the cosmetic range, perfumes, beauty, makeup preparation, and soap, organic soap, those products. Mainly for the Ayurveda category, we used Ayurveda oil, Arishta, and again for the Ayurveda soap and the use for raw material for the industries, different cosmetic industry, pharmaceutical industries, likewise. Those are the main products currently we are exporting. If we look into the exports in Sri Lanka, it is increasing trend. In figures we see in 2017 to 2020, we have export US dollar 27 million US dollar worth of export from the Ayurveda herbal products and cosmetic Ayurveda herbal and cosmetic products export from Sri Lanka. Those are the main market mainly we concentrate. UK, USA, Netherlands, Australia, Japan, India, Singapore, Maldives, and UAE. We know that the UK is one of good market for the Sri Lankan Ayurveda products, Siddhalepa, natural, those companies are currently doing their export into those markets. India also one of market for our herbal cosmetic, but they are rich with the herbal products, lot of more than us. But some our unique products are goes to India. Mainly we know that Link Samahan have a good established market in the Indian market, and the Siddhalepa, those products. Japan also one of demanding market for the Sri Lankan Ayurveda product, herbal cosmetic, and the cosmetic ingredients. But main challenge is complying to the Japanese standard. As I mentioned, Jazz is one of Japan organic system certificate. Other than that, they need to adhere to the ISO 19001 quality management system in the processing level, and they need very timely tested products for their market. And Netherlands, because of Netherlands is one of the main market in the EU region. Other than Netherlands, regionally, in the EU region, we have a good demand in the German market. German are very famous destination for the Sri Lankan Ayurveda treatment for therapists, those areas. We know that we have a few good industry players in the Ayurveda product sector. They are doing the different products into the different market, Europe market, German and Russia, Hectigoda Industries. Those companies are mainly doing the pharmaceutical, cosmetic, and mainly focused on Sri Lankan Ayurveda. Those are the well-established brands from Sri Lanka, from the Ayurveda and cosmetic sector. They are doing well in the market, but they have good facilities with the certification. Those are the main areas we consider into the Ayurveda and herbal product sector.
Okay, thank you so much, ma'am, for the valuable information you have shared with us in this regarding the Ayurveda herbal products and cosmetic sector. Thank you very much. Have a good day.
Thank you.
හරි නේද madam? Thank you and thank you very much.
හරි recording නැවතුවට.
ඔව් හරි.
හරි. ඊළඟ එක්කෙනාට තියෙන්නේ ආයේ cosmetic sector එකට තව එකක් යනවනේ නේද?
අදට
Five.
විතරයි නේද?
ඔව්. මෙච්චරයිද අදට?
දැනට මට නම් දුන්නේ මේ schedule එක. හරි අපේ ගයිඩ් කන්ඩක්ට් කරයි. එහෙම ඉන්ෆෝම් කරයි බලන්න. හරි මිස් thank you.
Okay, thank you. මම ලීව් කරන්නන්නේ